Communication is important to me every day in that I view myself as a small part of a larger culture of communication, which is really the world in which transplant and oncology patient care takes place. The most important communication, of course, is with the patient and their family, but I'm also very fortunate to have the opportunity to communicate frequently with fantastic team members, including my own infectious disease colleagues, the transplant and oncology teams, pharmacy, microbiology, social work, primary care physicians, consultants, and really a lot of the joy of it for me is getting to know and work shoulder to shoulder with these wonderful team members. What I'm most proud of in my work is to have had the opportunity to be part of and shape transplant programs at great institutions. I was at Cleveland Clinic for 19 years before I came to Johns Hopkins, where I've been for 5 years, and at each institution I've really had the opportunity to help shape some of the infectious disease protocols that protect our patients, our most fragile and immunocompromised patients, from devastating infections. What advice would I give to my colleagues? I think it's very important when I'm seeing a patient in consultation to think not only of the single episode of infection that I'm treating at that time, but to view this as part of a trajectory or a continuum over time for that patient. A question I frequently like to ask to the patient is, when did you last really feel well? You'd be surprised at some of the answers we get, and that gives you a much larger picture of the patient's world and the place of this episode of infection in it. In receiving this award, I really feel that the award is for our entire team here at Johns Hopkins and the way we work together. And I feel it is such a privilege to be a part of this and to learn from these wonderful people who I work with every day.